Imagine a future where illness isn't just treated, but predicted and prevented. A future where healthcare is as unique as you are. This isn't science fiction. It's the ambitious vision at the heart of a new revolution sweeping through the NHS. For decades, the NHS has excelled at treating illness. But now, Health Secretary Wes Streeting is unveiling a bold 10-year plan that promises to transform our healthcare system from reactive to proactive. The cornerstone of this transformation? Genomics. The revolution in medical science means that we can transform the NHS over the coming decade, from a service which diagnoses and treats ill health to one that predicts and prevents it, said Wes Streeting, stressing the importance of proactive healthcare. Within the next decade, every newborn in the UK could have their DNA mapped. This isn't just about identifying rare conditions, it's about whole genome sequencing, assessing the risk of hundreds of diseases, paving the way for truly personalized healthcare from day one. So, how will this work? Currently, new parents are offered a simple blood spot test for their 5-day-old babies, checking for 9 rare but serious conditions. A tiny heel prick collects a few drops of blood. The new vision, however, goes much further. Whole genome sequencing typically uses a blood sample taken from the umbilical cord shortly after birth. This comprehensive analysis assesses a baby's entire genetic makeup, offering a far more detailed insight into their future health risks. The implications are profound. Imagine a world where, instead of blanket screenings and basic health MOTs that only flag issues once they're entrenched, patients receive personalized health checks. This allows for targeted medicines to be offered earlier, even preventively, avoiding adverse drug reactions and ensuring treatments are tailored to an individual's unique genetic profile. Experts have long argued that tackling diseases like cancer and Alzheimer's means identifying them before any symptoms appear. This genomic revolution is designed to make that a reality. Genomics presents us with the opportunity to leapfrog disease, so we're in front of it rather than reacting to it. With the power of this new technology, patients will be able to receive personalized health care to prevent ill health before symptoms begin, reducing the pressure on NHS services and helping people live longer, healthier lives, said Wes Streeting, stressing the importance of personalized, preventive care. This genomic ambition is part of a much larger 10-year health plan, backed by a £650 million boost into genomics and a record £29 billion annual cash injection for the NHS. This plan outlines 3 major shifts in healthcare delivery. First, from hospital to community, rolling out neighborhood health teams to bring services closer to home, with greater use of private companies to deliver care. Second, from analog to digital, embracing technology like smartwatches, wearable tech, and virtual hospitals, allowing patients to directly contact consultants via Uber-style platforms. And third, from sickness to prevention, placing a greater emphasis on identifying risks early, through genomics, but also tackling wider determinants of health like damp housing and improving maternity outcomes. As we deliver the transformational shifts in our 10-year plan, from hospital to community, analog to digital, and sickness to prevention, it will have radical implications for services. Much of what's done in a hospital today will be done on the high street, over the phone, or through the app in a decade's time, said Wes Streeting. While the promise is immense, such a radical shift naturally brings forth important ethical and privacy considerations. Parents will consent to their baby's DNA mapping, but what does it mean for a child to grow up knowing they have a significantly higher risk of aggressive cancers or Alzheimer's disease, like the 27 cases found with the BRCA1 gene in a study of 7,000 newborns? This information, while powerful for prevention, could shape their future in unforeseen ways. Furthermore, the security of this highly sensitive data is paramount. While current programs store DNA, health records, and contact information securely with strict authorization, the recent £2.31 million fine against genetic testing company 23andMe for a cyberattack in 2023 highlights the very real threat of data breaches. These are crucial conversations that will undoubtedly unfold as the plan progresses. Wes Streeting has spoken of being inspired by Japan's approach to combining genomics and AI for personalized health MOTs. The NHS has already begun by screening 100,000 newborns for genetic conditions, This new 10-year plan isn't just an upgrade, it's a fundamental reimagining of healthcare. The vision is clear: to move beyond reactive treatment and embrace a future where the NHS provides healthcare free at the point of risk, not just need. A future where we are proactive in our health, preventing illness before it takes hold, and ultimately, building a healthier, longer-living society. The genomic revolution is here, and it promises to reshape the very fabric of our national health service.